Hi everyone, welcome back to my channel. I'm Bree and I'm a registered nurse. Today we're going to talk about the different pathways to becoming a nurse. So if you've ever thought of becoming a nurse or just curious about the field in general, you are in the right place. So healthcare encompasses many different disciplines that provide direct or indirect patient care. We ultimately are trying to make sure our patients go home happy and healthy. So the nursing profession is the largest occupation in hospitals, with about 30% of all hospital employees being nurses. There are multiple different pathways to becoming a nurse, and today we're going to discuss a few. Alright, so to give you a little bit of background, there are two general types of nurses. One type is called licensed practical nurses or licensed vocational nurses in some areas. We will be calling them LPNs throughout the video. The other type is called registered nurses, which we will be referring to as RNs throughout the video. So both types of nurses provide patient care by working in a variety of healthcare settings. These settings can include hospitals, nursing homes, outpatient facilities, etc. Though both typically provide patient care, they have different educational preparations and different limitations on their scope of practice, which will vary depending on the facility and the state that you practice in. So according to allnursingschools.com, LPNs provide basic nursing care, including checking blood pressures and certain catheters, ensuring the comfort of patients by assisting with activities of daily living, discussing healthcare with patients, and reporting status of patients to registered nurses and doctors. On the other hand, they define RNs as those who administer medication and treatments to patients, coordinate plans for patient care, perform diagnostic tests and analyze results, instruct patients on how to manage illnesses after treatment, and oversee other healthcare workers such as LPNs, nursing aides, or home care aides. So how do we get here? So to become an LPN, you must first obtain a diploma or associate degree, specifically in practical nursing. These programs can take anywhere from 1 to 2 years to complete. RNs, on the other hand, have to get a degree. This degree can be an associate's degree in nursing, also termed an ADN, which typically takes 2 or 3 years, or they can obtain a Bachelor of Science in Nursing, which is a BSN, and takes anywhere from 3 to 4 years to complete. Both types of nurses are required to take certain courses and complete clinicals in person before they are able to graduate, sit for the NCLEX, and become a licensed practical nurse or a registered nurse. So the average pay for staff positions as an LPN in the whole US is about $55,000. And the average pay for a staff nurse as an RN is about $81,000. Now this will vary dramatically from state to state, based on location, based on specialty, and a lot of other factors. But this is just for staff positions, and there is a potential to earn way more than these figures based on your specific specialty, how much experience you have, whether you're entering into travel contracts, etc. So you might be wondering, which pathway is right for you? So that will depend on multiple factors, but I found that it will mostly depend on your ultimate career goals and what type of setting you want to work in. So if you have a goal of eventually becoming an NP or pursuing higher level management positions that require a master's degree in nursing, you will likely need to get a BSN and become an RN first in order to pursue these other opportunities. Because to get any type of master's level degree, you do need a BSN first. So also, depending on your location, it may be harder to find a job in the exact specialty that you want as an LPN or ADN prepared RN. This will depend on individual healthcare systems and location overall. It is definitely possible to work in the hospital as an LPN or ADN RN, but BLS reported that only 14% of LPNs work in hospitals, while about 61% of all RNs work in hospitals. So if you have a dream of working in a hospital, maybe the RN route might be a bit more beneficial to you. But if you're comfortable with outpatient settings, rehab facilities, nursing homes, then LPN might be the right route for you. So now we're going to discuss some common misconceptions or myths about nursing preparations. There is a common myth that LPNs only work in nursing homes. This is totally false. There are many hospitals and outpatient facilities that employ LPNs, with the only difference being that they have certain limitations on the care that they can provide. But this is often not a barrier because RNs are often present at these facilities as well and can work in conjunction with these LPNs in order to provide the care that the patient needs. Another common misconception is that associate degree prepared nurses are no longer being employed by hospitals. So this is also not true. Hospitals are really hurting for staff in general, but especially with nursing staff. So they are willing to employ anybody who has an active nursing license, and can provide the patient care that they need. The only limitation that I've actually seen is that ADM prepared nurses are sometimes ineligible to serve as charge nurse, but this is often not true at some hospitals, and a lot of people don't mind not ever having to be a charge nurse. A third myth is that LPNs and ADM prepared RNs are being phased out. This is also completely false. If this were true, the healthcare system would not have enough nurses to provide care for all our patients. With such a small amount of BSN prepared RNs coming out of nursing school each year, and with the exodus and the leaving of so many nursing professionals, there simply would not be enough BSN prepared nurses to replace all the other types of nurses. So I don't foresee this being a problem in the near future, especially with healthcare exploding as much as it has. Whether you are an LPN, RN, NP, or something else entirely, all nurses are vital to the healthcare structure in this country. Nurses also heavily depend on our techs, aides, any other type of assistance to help provide patient care. We all really couldn't do it without each other, and we all work together to make our patients whole again. As healthcare providers, we all work together to do what is necessary for our patients. If you found this video at all helpful, like, comment, and subscribe. Tell me what your plans are for entering into healthcare in the future. Thanks for watching. Bye.